Hello, everyone. Thank you for joining this session, and I'm happy to welcome you to the fully youth-led World Health Summit 2020 panel hosted by International Federation of Medical Student Associations, which is the oldest and the largest youth-led organization globally, representing 1.3 million medical students worldwide, as well as 134 countries. My name is Agla Yanushonite, currently Vice President for External Affairs at IFMSA, and today I will guide you through our double panel discussion. So today we will be having two distinct panels that will discuss the role of youth amongst the response of the pandemic, while the second part of our panel will have distinguished speakers that will share their thoughts on gender engagement in youth. So for the first part, I'm going to introduce our speakers. So firstly, Ms. Omnia El Amrani, who represents the International Federation of Medical Student Associations as Liaison Officer for Public Health Issues. Then also joining us today is Professor Shaima Enani, who is from the Egyptian Young Academy of Sciences and the Department of Microbiology and Immunology, and is an associate professor. Also joining us today, we have Ms. Dr. Smith, who is the Health Governance Research Associate at the Hertie School in Berlin. Another guest of ours is Ms. Sofia Slamka, who is from Global Shapers Community and also the curator and co-founder of Voices. And last but not least, for the first part of our panel, we will also have Ms. Hera Ali, who is from the International Pharmaceutical Students Federation. Throughout the first part of the panel, you will be also able to give some questions to our speakers, so you can do that through Q&A function, and the questions will be answered at the end. So without further ado, let's start our discussion with the first question. What do you think are the main impacts that COVID-19 had on youth and adolescents? So we will start with Omnia.
Yes, thank you everyone for having me and for this very interesting discussion. So first of all, in my perspective and in IFMSA's perspective as a research-oriented and evidence-based advocacy organization, we wanted to really understand how has COVID impacted youth and adolescents. So we partnered with 3 youth-led organizations in the WHO, and we conducted a global survey. This survey had responses from over 2,600 young people, and they reported that more than 50% of them had symptoms of anxiety and distress, mainly due to the overload of misinformation that was happening around COVID. In addition, they experienced anxiety due to also the physical isolation due to confinement and lockdown, but also the digital isolation because of the economic impacts of COVID on the lack of income and decreased incomes, which makes them unable to even buy their data bundles to get access to internet. In addition, we have seen a lot and a significant rise in gender-based violence and domestic violence, and youth saying that they do not have any safe spaces because of the lockdown. In addition, we also saw how COVID has impacted their education. And we have been tracking this down, especially in our medical education. And we have seen that in many countries, for example, in Kenya, our medical students told us that there wasn't any e-learning available for them. So this really impacted their medical education drastically.
Thank you, Omnia, for sharing these insights. I would direct the same question to Ms. Hera.
Thank you so much for giving me the floor for this question. So my answer is kind of a bit similar with Omnia, being both like student organizations. A lot of our focus went on to education and the impact of the pandemic on the way that education was moving forward and learning. So once the universities began to close at the very beginning of the pandemic, one of the main areas that we wanted to focus on is like how exactly will our students be impacted, because our federation represents over 100 countries, so we knew that the impact was going to be widespread. In our pharmacy education portfolio, we held a survey which focused on the impact of remote working and the impact as well on mental health. We had over 204 responses over 44 countries in all of the IPSF regions. And one of the main questions that we asked was, are students even accessing remote learning? Like, is this even a thing that's occurring in their education? And we found out that, 69% of students were actually engaging in remote learning during this process. However, that meant that there was a staggering, 31% of students that had their learning experience completely come to a halt. And they mentioned, there was various reasons why this happened, and they had, various difficulties where a lot of them, it was due to access of internet, which, isn't the same all over the world, and the regions that we represent, some are less developed, and it meant that access to remote learning just wasn't possible. And the purpose of this survey was for us to identify, what gaps were there and how we can then move forward and address these gaps and provide the right services to our members to help with education, because it's such a massive part of our learning when we're in youth. And so for us in IPSF, I think education and learning was probably the biggest impact of the pandemic. Thank you.
Thank you so much for your answer. And definitely these gaps are extremely important to indicate so that we can address them further on. And lastly, with this question, I would also like to address Ms. Tukte.
So thank you, Egle, and thank you, Omnia and Harameki. Maybe I can summarize the points. So indeed, we see that this crisis has forced the governments and systems to find digital alternatives. And this also put some students in an unequal situation, because this also meant that if you were lacking some infrastructure, such as a stable internet connection, this was a clear disadvantageous position. And so this created also not only for the learning process, but also in workforce, some inequalities. And we will see the impact of the inequalities between and within the countries in the coming years. So I think this is the first major problem. And the second is the personality development of youth. So of course it is important, and it was a very difficult situation for all of us to get this social distancing measures. But if you're, let's say, so 12, 13, you're in the age to develop your personality, and you need this social contact very much. And I think this is the second biggest problem. And accordingly, so as a third problem, we can also say the mental health issues, and which was also accompanied by the job loss and job insecurity. Whereas I must also say the pre-COVID time was also not optimal, right? This consumerism that we had, it was also not sustainable. So we also need to think about other alternatives, not during the COVID-19, but also after COVID-19.
Thank you so much. And definitely the insights that you shared leads us actually to our next question, which is, what are the actual challenges that youth have faced in order to get involved in the global and country level response to the pandemic? And what are some of the success stories in the organizations of young people that have contributed towards COVID response? And I would like to direct this question to Dr. Shaima. Over to you.
Hello. Actually, I will speak directly about the challenges which we faced in Africa, because this is my major. In Africa, there is many reasons for challenges. For example, the poverty, not only poverty, but extreme poverty in most countries, especially in sub-Saharan region. This poverty, which leads to hunger, leads to many diseases spreading. Also, Africa have a double burden of diseases, and COVID-19 adds insult to injury in this content. Adding to that, under-reporting for most cases, or the confirmed cases on COVID-19 in Africa due to the less developed healthcare system. But even though of all these challenges in Africa, we gathered together as a young scientists from the Next Einstein Forum group, and we make an initiative collecting different scientists from different countries in Africa. The aim was the mitigation for responding to COVID-19 spreading in Africa. They are including several teams, for example, for the policy action against COVID, for education against COVID, for diagnosis of COVID. And I was involved in the team of COVID diagnostics in Africa. We are working in multi-sites They make like an assessment for different places in Africa, like Kenya, Malawi, South Africa, Egypt, and we collected all the data and all the diagnostics tools which is available in these countries as a multi-site African assessment for the performance and implementation of the 3 different diagnostics platforms in these countries. And also, as a group of young scientists, we implemented with another global working groups for diagnostic implementation, which augmented the diagnostic in Africa through raising funds or collecting funds from funding agents like Bill Gates Foundation or the WHO. Thank you.
Thank you so much. I would like to now direct the same question to also Ms. Sophia.
Thank you very much, Egle, and thanks for having me on this panel. I would like to address one of the challenges we experienced as a youth organization, Global Shapers Network, and also a success story, which will follow after. So with Global Shapers Network, we are a youth initiative of the World Economic Forum, and we work on a global as well as on a local basis. So I'm currently curating the Cambridge Hub in the United Kingdom, and I'm personally now in Spain. I'm originally from Hungary. The pandemic brought me back to my home country. And this is already pointing me towards a challenge that I would like to discuss. As a youth organization, a lot of our members were all of a sudden, because of the pandemic, migrating back to their home countries, suddenly leaving because of travel restrictions, because of universities asking them to return to their home countries. And all of a sudden, what we experienced is we were spread all around the world, sometimes with intermittent internet connection, while wanting to still work together and come up with one clear agenda as to what we are going to do. This was a challenge that we experienced in our particular hub, but was then reported by other hubs, at least in my European region. Now, a success story relates to the mental health consequences of the pandemic. And this initiative was running in Hungary, in my home country, and in the United Kingdom, where I've been working for the past couple of years. We started peer support networks for students and for young people to support each other's mental health. And then we developed a 3-session-long online brief counseling program, which worked, of course, on a remote basis for young people and for people in general who were in need of counseling and of counselors during the main lockdown months, which was running from March to May. Now, this was a success story for us because this was something that we were developing very quickly as the pandemic was evolving from March onwards. And we managed to provide services to young people from both of the countries. And then along the way, we managed to also develop services for employees of universities from Hungary as well as the UK. And at the moment, we are working on how best to further develop these services now that the second wave is hitting us. We learned a lot as to how we can work as psychologists, as mental health providers in the online space. I'm hoping that this is something we can keep working on. Thank you.
Definitely, and thank you so much for your answer. Heading to the next question. Meaningful youth engagement is definitely a buzzword in global health nowadays. So I would like to ask, how would you evaluate young people's involvement in battling the pandemic on global level? And was it meaningful? So I would like to direct this question to Ms. Omnia.
Yes, I think this is very important, and COVID-19 really gave us the opportunity to step back for the first time and see what the definition of meaningful youth engagement is. And why am I saying that? Because working with IFMC during COVID times, I was really inspired by our response and by the efforts led by our medical students to be meaningfully involved, both in the global and the national response to COVID-19. So, for example, I saw how our medical students in Lebanon, they had collaborated with their government, with their WHO country offices and their NGOs, and they volunteered more than 200 students of them in their national call centers in order to answer all the COVID-19 related questions in addition to other initiatives that they did together with their government, which is really a success story of how meaningful youth engagement can really push for the COVID response to be effective, and at the same time, it is possible. And I also saw in Germany, where we are virtually, medical students collaborating with their own NGOs, and they developed a mobile application called Match for Healthcare in order to match anyone who has any symptoms of COVID to the nearest healthcare institution to them. And they did not just do this on their own, they did it in collaboration with other national stakeholders. So meaningful youth engagement, we've seen a lot of success stories, but we've also seen a lot of challenges to that, because these are not just the only activities we have. We have additional to that 75 activities led by medical students around the world, reaching over 4.5 million people. Most of them are done on their own capacity and trying to be meaningfully involved. So this is really a demonstration of what youth are capable of, and why all this why we are a key stakeholder, and why should governments as well as civil society organizations work with us and make sure that our engagement is not just meaningful, it is also sustainable and consistent. We are there for the long term, and we want to work together as a key stakeholder to build back better. Thank you.
Thank you so much, especially for the point of sustainability. It's really quite inspiring. And now, Ms. Hera, you are also a part of a global student-led organization. What are your thoughts on this?
Thank you so much. So yeah, I mean, I definitely agree that, meaningful youth engagement became a really popular or like a really important thing to consider when the pandemic hit. And I think meaningful youth engagement, it can encompass a lot of things, the number of people that you impact, the kind of activity that's being taken place. And I think, all the contributions that took place from our member organizations in IPSF all across the world, all of them were actual meaningful engagements, because they were having direct impact on the communities and the public and those that were in need. And for example, we had, our member organizations in Kenya who helped develop, affordable ventilators, which meant that, in countries which are LMIC, where, the healthcare infrastructure is not as, strong or as developed as it might be in, where I live, which is in the UK, those countries are not as fortunate. And so when it came that we had students of, our own federation working on these ventilators, it really brought a sense of proudness that overcame, because, these students were working on projects which we didn't initiate them on at all. It was just out of their own initiative. We also had students in France who created a website that would direct pharmacy students to work with local community pharmacies, because those were one of the primary healthcare providers that became under a lot of pressure during this time. And, students thought, what better way for us to directly help the public than go and volunteer in these workspaces. So I think that, like I said, meaningful youth engagement can come across various ways, but the kind of impact that you have and the activities that you're doing really are some of the important things when thinking about how meaningful it is. Thank you.
Thank you so much, Ms. Hera. So far we have heard quite a number of inspiring examples of the work being done all around the world, in Lebanon, Kenya, Egypt, and other countries. But now, just to change the questions a little bit and to change the direction of our discussion, the pandemic has been going on for quite some time now. And my question directed to all of the speakers would be, do you have an unpopular opinion on how COVID response was conducted globally? And I would like to start this question with Ms. Tukse.
Yes, indeed, I have an unpopular opinion, although it is very challenging for all of us, to keep the social distancing, and some countries needed to go locked down, and we saw very challenging times, and it is still challenging indeed. However, when you look at the ecological damage that we have done throughout the years, so in the previous years, I think we should talk about 2020 Earth Overshoot Day. So I think you all know it, but maybe just a brief background. So Earth Overshoot Day is the date when humanity's demand for ecological resources in a given year exceeds what Earth can regenerate in that year. So it started already in early 70s. When you look at the age of the Earth, so it's like yesterday. And in this 50 years, we had 18 years of ecological debt. So in other words, it would take 18 years of our planet planet's entire regeneration to reverse the damage from overuse of natural resources. And I think it is very important because for 2020, the date was 22nd of August, and for 2019, it was the 29th of July. So we had an increase of 24 days, and it was never seen before, you know, and it was because of COVID-19. So it is nothing to celebrate, don't get me wrong, but maybe we want to keep and maintain some of the practices that we used in 2020, you know, not flying, but taking train, riding bicycle instead of driving car, or conducting digital meetings. So this is my unpopular opinion.
Thank you so much for sharing this insight. I would like to also ask this question, Dr. Shaima.
No, actually, for my unpopular opinion, I like the semi-lockdown, which is happening in some countries. For example, the decreasing the probability of COVID-19 infection, but does not inhibit it completely. So until now, there is no one can stop it. But for example, especially in the low and middle income countries, I think going to work, going to shopping, for example, until 5 or 6 p.m. And after that, completely quarantined at your home. In this manner, we can reduce the probability of infection, and at the same time, the economic will not be greatly affected. And I think this is most important, especially in poor countries or low and middle income countries. Thank you.
Thank you so much. Ms. Sophia?
Thank you. So my unpopular opinion is about the interventions and the responses we've had to the first wave of infections. And now I would like to point out that I'm not referring to the youth response in particular, but to the response in general. So what I observed through the Global Shapers Network and through my mental health, my involvement with mental health, is that because this was such an unexpected event that happened all of a sudden, we all tried to react very quickly, and we were from all professions in an intersectional way. We thought we must act, we must do something, we must do our best professionally. We had this sort of moral obligation to help each other as humanity, which is of the best intention. What I observed that in parallel with this, what we sometimes forgot to do is to measure impact, to see whether what we do works. And now this refers to how to relieve the social and the economic impact of the pandemic, how to relieve the mental health impact of the pandemic. So there were a lot of interventions started, a lot of initiative taken. And sometimes we didn't really know with what efficiency these interventions worked. And I was just chatting with some of the colleagues yesterday, and I was, and then they made me think how this will impact how we react to the second wave. And what I think, at least in my very job, in my profession, what I am going to do is that we will keep addressing the problems. We will keep addressing the problems that we might not have faced in the first wave, but only in the second wave. But what I will keep in mind is to make sure that we follow up on what impact our work does, like follow up with patients, follow up with clients, and see how far our interventions reach. And similarly with the Global Shapers Network, we did various social media campaigns, outreach activities to spread information. We will make sure that in the months that follow, we will follow up on who we reach, how we reach them, how they perceive any interventions that we may make, and I'm encouraging all my colleagues to do the same.
Thank you so much for highlighting the need to review the impact. And now over for the medical students' perspective, Ms. Omnia.
Yes, I really love how it was highlighted the importance of evaluating what you do. And this really comes to my very own unpopular opinion, because I've seen since the beginning of COVID and all the conferences and the webinars and the sessions, how we talk a lot about the failures of the global community, but also the success stories of the global community and the lessons learned to build back better. But the biggest question that I always ask myself is, how are we going to build back better? And how are countries, as now they are recovering or restarting their economies or creating their own stimulus packages, how are they going to invest in better public health measures? Are they going to increase their funding in data and statistics? Are they going to increase and prioritize universal health coverage, for example? And the other question is, are their investments going to be green? Because COVID-19 is not the only global health threat we're facing. It is a wake-up call to future crises, and climate change is one of them. So are we going to also prioritize climate change? And this is why, as medical students and as IFMSA, we have joined a global call with global climate and health community, over 35 million healthcare professionals, calling on countries and world leaders to both invest, prioritize in healthy post-pandemic recovery that is green and that also places both our health as youth and the health of the environment at the center.
Thank you so much, especially for highlighting that this is definitely not the only challenge that we are facing as a global health community. And now, last but not least, I would like to ask for input for Ms. Hera Ali from for the pharmaceutical students' perspective.
Thank you so much. So I guess my unpopular opinion, I don't really know if it's really unpopular or, but I think for me, it was from IPSF's perspective, it was the lack of regulation when it came to the information that was being put out onto social media when it came to COVID. From our perspective, it looked as though, there was very poor regulation. Not a lot of the information that was being put out there was being monitored. And that kind of led to a lot of, big consequences, which meant, people were not believing that COVID was real. People thought it was from 5G. There was a bunch of rumors that were going around and a lot of, false information. And I think this really kind of impacted the spread of the virus. And I think that's why when the first pandemic, well, in the UK is the perspective I can use, but when the pandemic first began, the speed at which it increased and the cases that rose and the deaths and everything, a lot of that could be down to the fact that a lot of this information that was out there was not true, it was false, but people were believing it because this was what was being fed into their daily readings on social media, in WhatsApp groups, etc. And I think for me in IPSF, this is one of the biggest things in terms of unpopular opinions, is that there was just not strong regulations that went out about this. And I can kind of tie it in with my day job as well, which is I'm a pharmacist in hospital, and I could definitely see people's understanding when they were being admitted for COVID. And when you speak to them, or well, not necessarily speak to them because you wouldn't want to get too close, but when you would hear their stories, and a lot of them just never thought it was real, and they didn't understand the seriousness of it until it was either them in hospital or it was a loved one. And that's really dangerous. You don't want people to only be taking it seriously when they become, a victim of the virus. So I think, so lack of regulation of the media that was being put out there.
Thank you so much for your answer. I think it's very crucial that we discuss our unpopular opinions, and that our unpopular opinions not only remain our thoughts in our heads, but also become concrete calls for action, and that we use this to make the change. And thank you so much for all the speakers for this answer. We will move on. So the next question would be, could you give one advice or a tip on how can governments and civil society work better with youth to address the response to the pandemic? And also attached to this question, another question, which is, as we know, in many countries, youth have been in some ways mobilized to help fight the COVID, but is it ethically responsible to have youth involved in this response? So I would like to hand over the floor to Dr. Shaima.
Actually, I think that the government can use youth for better. For example, if they are trained well, they can use them as a volunteer, acting as a volunteer for example, for collecting samples, for testing, for data analysis, and also could be a volunteer in some local media or science organization, hospitals, healthcare organizations. Also, they can contribute for help to bridge the gap between science and policymakers. They can contribute in some biosafety guidelines in the hospital, in schools, in media. For example, as I told you before, one of the successful stories, we make an initiative on Facebook just for preparing some very simple tips in our language, Arabic, and in a very simple English to all the society, just to raise their awareness about the COVID-19, how to prevent it, how to prevent the infection. And I think if the government use the youth, they can make a very good link between government or policy and the society, and they can use youth very good. About the second part, which is it ethical to use it? I think, in my opinion, yes, of course, it's ethical, especially if they are trained and well educated. Thank you.
And thank you so much for your thorough response. And I would like to direct the same question to Ms. Zofia.
Thank you very much. I would like to address the second part, which is about whether or not it's ethical to involve youth. And I've been reflecting a lot about this question because what I think this pandemic showed, at least to me, is that this is an area, because of how unexpected all it was and because of how little we know about this virus and how to tackle it on a global scale, where age doesn't seem to matter so much anymore because of how little we know. And if this is something that I learned, then from this, what I would conclude is that we should let everyone be involved who has the capacity and the training to contribute with something. And on this front, actually, the fact that it's young people or older people or senior people or professionals, these labels somehow lose meaning for me. Some of the best innovations in the pandemic come from people who have not even finished their university degree or might not have gone to higher education at all. And so in this perspective, I think it is ethical indeed. And moreover, I would give the voice and the chance to everyone who volunteers or who has the capacity to add to our response to the pandemic.
Thank you so much for sharing your thoughts. Now, before we go on, we only have one more question in the panel left. However, I would like to take some questions from our audience. And the first question is addressed to Ms. Somnia from IFMSA. If you could share where it is possible to find the link for the survey you mentioned, and if you would like to elaborate a bit more on the survey.
Yes, absolutely. I'm very happy that there was interest in our survey. So currently we started our survey around 2 months ago, and we had over 2,600 responses. We actually collaborated with 3 youth organizations, the APWIN, which is the Health Emergencies Department, and we developed the questions with them. Right now, we had the opportunity to share the results of our survey in several conferences, but we wanted to develop a more comprehensive report because our survey not only talks about the mental health impacts of COVID-19 on youth, but also talks about misinformation, which is what Hera has touched on, and it's super important. And we really, in our survey, we asked where do youth get their information on COVID? And we discovered that the top 3 resources were the TV, social media, and the newspaper. And we also saw that the anxiety and the distress was due to the misinformation and the overload of all the social media info about COVID. But also we had a smaller percentage of youth, around 11%, that had a feeling of optimism towards the future in terms of the post-pandemic recovery. We also had another survey conducted in parallel to that to map all the fact-checking organizations around the world that bust the myth. So far, we discovered 184 organizations in over 60 languages. And we wanted this information to be available for the public so that they can access and find out where their organizations are. For example, if you're in Germany or in Egypt or anywhere in the world, you can check whether there's a fact-checking organization in your country where you can enter the information related to COVID and check whether it's correct or not. And we collaborated with Rhineland University, and we developed a map that I can also share the link to. And this map has all these fact-checking organizations and the languages that they translate the myth-busting in.
Thank you so much for elaborating, Omnia. The next question is to all the speakers. So the question is as follows. As we discuss meaningful youth participation, how do we ensure meaningful youth engagement with high-level meetings and decision-making platforms when all of these meetings now are virtual? If you would like me to repeat the question, that's also possible. Ms. Hera, if you would like to start.
Thank you so much. So actually, from my perspective, I don't think going virtual is a barrier when it comes to opportunities to get involved. Actually, I think it enhances and gives us more opportunities because we're not limited in traveling or other, aspects which might limit our participation. I think some of the best ways to get involved in the high level, meetings and other organizations sessions is by, first of all, finding out what on a national level, what kind of organizations are going to be more suited to yourself. So whether it's a, healthcare professional organization, or if it's to do with, what your interests are, if there's what on a national level is available to you. And then from there, you can look at what is available to you on a global level and how can you get involved in there. So I think usually the organizations which work on like a global level are the best ways to get involved in high level discussions with, IPSF, IFMSA, other student healthcare organizations. These are the best platforms, and we often get, invitations, or we get the ability to get involved in these organizations. So I would definitely start, national, then global, and see how you can actually get involved and take part. Thank you.
Thank you so much. Over to you, Ms. Sophia.
Thanks a lot. In fact, I'm with Hera on this one, in that going virtual, I think, facilitates youth engagement. From the Global Shapers perspective, what I can share is that in the pre-COVID times, a major limitation to our participation in higher level meetings was lack of funding, lack of the ability to travel to somewhere, afford accommodation in a certain country. Whereas now we are just automatically added to or invited to some of the events which previously it would have been literally impossible for us to attend. And this also means that participation can take place with a higher number of young people because of the ease with technology in doing so. So this is my experience so far.
Definitely, and thank you for our answer. And I think the best example is this session happening right now that can be accessed to youth all around the world globally. And over with a question to Ms. Tukce.
So thank you. Indeed, I also agree with Sophia and Hera on this point that this virtual platform is not a barrier, but also I can understand the question that maybe he or she wanted to mean the informal information exchange was lacking. And if you're in the beginning of your career as a student, you of course not only want to hear a presentation, so get this hard facts and knowledge, but also some informal information exchange that you have the feeling, so how can you develop your career? And for that, I can just advise, be proactive and write people, so in online platforms or in, so also at the World Health Summit, we have this kind of meet and greet sessions. I think use this chance and be proactive and reach out to people, yeah.
Thank you for the advice and the tips. And now over to Dr. Shaima.
Actually, I agree with all the answers. And as you said, this is as we are now online. So I think this is the best way to ensure the engagement of the youth in the meetings, just by joining the webinars or the presentation which are doing online, and they will be active and they will be involved. and they can reach easily to many decision makers and policy makers through online, just to be working hard and try to search for the best thing that fit their interest. Thank you.
And thank you. And Ms. Omnia, if you would also like to add some finalizing thoughts on the question.
Yeah, I just wanted to highlight from our previous experience with IFMSA. As you said, it's now easy because everything is virtual, and I think it presents you a great opportunity for you to not just attend sessions or deliver interventions, but also to host your own side events or co-host your own proposal. You have, like what we did now as IFMSA, we're collaborating with WHS, but we also did this on multiple occasions with WHO and when the World Congress on Public Health. We had the opportunity to host sessions and deliver sessions, share our own experiences as youth, because there are many webinars happening around the world talking about the COVID-19 response and the lessons drawn, but we can also bring in this unique perspective, because we can bring in our own needs as youth, but we can also bring in the needs that we identify with the local communities that we work with and demonstrate the surveys, the research, the data that we collect, and simply the best practice initiatives of both our own youth-led activities, but also our involvement with other civil society organizations. So it's a great opportunity to foster partnerships with organizations that we normally didn't have access to because we're not in the same country or we're not able to travel, but now we can do these on meetings and get to collaborate together on meaningful events that benefit both organizations and communities, but also benefits our members as young leaders in their own countries.
Thank you so much for your answer. So with this, we end our Q&A session and we go toward our last question for the panel. So for all the speakers, from all that we discussed, what do you think is the most important lesson that we learned during this outbreak? And where do you think a youth intervention is most needed to further efforts so that we head towards a strong and just post-pandemic recovery? And this question, I would like to start with Dr. Shaima.
Very simply, I think that the lessons is we are one globe, we have one health, and all countries now, all continents and all countries now facing the same problem if they are developed or developing countries. So I think we should collaborate together because, as I said, we are one globe and we have one health. Also, it's very important to be ready for the next pandemic and to learn very good from what's happening nowadays. Science and youth are considered the main pillars for recovery of any pandemics. So now we should focus on linking between science and youth and the policymakers. That's all. Thank you.
And thank you so much. Over to you, Ms. Tukte.
So thank you very much. I think the most important lesson that we should learn out of this crisis is that, and it is articulated many times, health is a political choice. And in the policymaking in the recent years, so when you see that you need to decide between health and wealth, and the policymakers usually chose wealth, also with the notion of wealth brings health. But the reverse is also true. Without health, there is no wealth. And public health is in fact a field that picks up the pieces from other sectors. So when you have low levels of education, some bad policies in education, you see also low health literacy. When you have bad policies in transport, you don't have cycling lanes, you have rising levels of non-communicable diseases, low physical activity. When you have bad policies in food and agriculture, you see the rising levels of obesity, again, because of the low quality of food, and you don't have any subsidies in fruit and vegetables. And also, you also mentioned, Shaima, I think, it is one health, so it is the antibiotics that we take in our body. So when you have bad policies and you use antibiotics in food and agriculture, you also have it in your body, and rising levels of AMR. So usually the public health picks up the pieces, and from political point of view, it was fine for policymakers as long as these bad consequences could not be traced back to them directly, right? So this kind of bad health outcomes you see in a couple of decades, whereas COVID-19 kind of unveiled the short-sightedness of their political choices. And we see also in some countries, they pay for the mistakes of policymakers in 1980s, the politicians who had recognized neither the value of public sector expertise nor of public service provision. And this should change. So what should we learn out of this crisis? First thing first, strong health systems, invest in health, invest in public health, and use the intersectionality. So I think this is the lesson that we should learn.
Thank you so much. I would like to give the floor to Ms. Sophia now.
Thanks a lot. And I resonate with what has been said before me. I also think that this pandemic showed us the importance of having strong health systems and particularly basic healthcare for all. We've seen in so many countries all around the world, high income, low income, how the lack of basic health services will really impact all of us in all ways, economically, socially, health-wise, mental health-wise. So for me, that's the most important that we learned and we should learn. And as for where youth involvement could be even stronger, is spreading the news about this, and also that we become innovative in creating our own jobs and new ways of working. Something that goes somewhat hidden is the number of young people who are unemployed or graduates who can't find jobs or struggle with that. I think this is a time where it's an open space. It's a crisis, an open space where we can shape our futures and what jobs will look like in the future. I think this is very hard. I don't yet know what this will mean exactly, but I do think that this is where youth involvement can be even stronger. Thank you very much.
Thank you so much, Ms. Sophia. And handing over the question to Ms. Hera.
Thank you. So I guess my answer is kind of using a bit of a buzzword, but not really, because what I want to say is that I think the most important lesson that we've learned is emergency preparedness. But when I say emergency preparedness, I don't mean like health systems, etc. We know that that is, something that everyone has come to learn, that, as Sophia has said, that it's a massive, it's identified massive gaps in health systems. But when I mean emergency preparedness, I mean for everything else, like stuff like education and learning. I think that's like a really massive gap that has occurred so far, like during the pandemic. It's not really something that has been addressed that much. And I think that when we move forward and we kind of, we say post-pandemic, but when is this post-pandemic? Like we're still in it, so I don't really know. But so yeah, I think like having more identifying more like preparedness for education and learning to ensure that we don't face this issue where learning is completely halted for months and months with no idea of when it's going to continue. And also we should be able to utilize better the online platforms that exist for learning, and we need to identify the ways that we can make it accessible to everyone, because as mentioned earlier, online access and internet access is one of the biggest barriers for students and young people when it comes to education and learning, and we need to be able to identify how can we overcome this. I think another thing in terms of involving youth is that now that we've kind of had like a good chunk of months in this pandemic, we really, as mentioned earlier, we need to evaluate what kind of long-term impact is this pandemic going to have on students and young people, and how can we work with high-level organizations to help facilitate the gaps that have occurred, and how can we prevent this from happening again in the future. As mentioned, emergency preparedness, but for all aspects, not just health systems. Thank you.
And thank you so much also for your inspiring words. And we will finish this part of the panel with intervention of Omnia. The floor is yours.
Yes, thank you. So I think Hera really brought in what I wanted to say, because I think the biggest lesson for me was how COVID-19 showed how active youth are, either at the front line as healthcare professionals or even at home, raising awareness and being active and volunteering and doing as much innovative and digital interventions as possible. And where is youth intervention needed? I think before we ask this question, we need to think about how such interventions can be institutionalized. So we have a space for us to be always active within our national governments, within our civil society organizations. Because I think COVID is just this wake-up call that is calling on the governments and the different bodies to step out of what they normally do, of their comfort zone, and to redesign the way their bodies are, to include more youth representatives, to include youth advisory boards or youth councils, to really deliver and participate in the way of shaping both global and national frameworks to tackle the pandemic. Because our opinion is important, we can bring in our energy, our innovation, but also most importantly, the sense of urgency to take action, because at the end, this is our future and both our health, our current and future generations, but also our planetary health. So there is a lot of emphasis on how we need system solution for the pandemic and for the post-pandemic recovery. And as youth, we need to be part of the system. So thank you so much.
And thank you so much. With this, we will conclude the first part of our first panel. Thank you so much for all the speakers who dedicated their time and shared their valuable insights. I think that we have heard a number of different barriers, but as well as solutions on how to further continue with the COVID response. For all the young people who are here, I would also like to echo Omnia's words that this is our future and our health. So for those who are watching now, we also urge you for a call for action, to take your place at the table and to be meaningfully involved in the health emergency responses. Thank you so much for all the speakers and the audience. And without further ado, we will be moving on to our second part of the panel. Our second part of the panel will focus on gender and COVID response. And while we have observed different exacerbations of gender inequalities by COVID, we have also seen some brilliant examples of women taking the lead. And without further ado, I will introduce our speakers for the second panel part. So first of all, I would like to introduce Dr. Rupa Dutt, who has founded Women in Global Health and is the executive director, also a passionate advocate for gender equality in global health and a leading voice in the movement to correct the gender imbalance. I am also very happy to say that Dr. Rupa Dutt is also an alumni of IFMSA and the previous IFMSA president. For our next speaker, we have Dr. Nicole De Paula, who is chairing the Women Leaders for Planetary Health Organization and also is the inaugural awardee of the Klaus Stoffer Sustainability Fellowship at the Institute for Advanced Sustainability Studies. Next, we also have here with us today Ms. Yeva Barankite, who is representing the International Federation of Medical Student Associations as Liaison Officer for Sexual and Reproductive Health and Rights Issues, including HIV and AIDS. We also have with us today Dr. Colleen Matar, who is chairing the Global Health Workforce Youth Hub. And I'm also proud to say that Dr. Colleen is also an alumni of IFMSA. And last but not least, we have with us Mr. Martin Blomer, who is representing the Young Leaders for Health. So with this, we will start our second part of the panel. And the first question that I would like to direct to all of the speakers is, women are a huge part of the global health workforce, yet this is not represented in the decision-making entities. Why is that? I would like to start this question with Dr. Rupa.
Great. Well, thank you, Agla, and it's wonderful to be here with all of you. And these are one of the most exciting conversations when I get to talk to young people. And I'm just so impressed by the panel before and to hear of all the great things that are happening. But really, just to focus on the gender dimensions, and both in COVID-19, but more widely in global health. What we often talk about is when you take a look at global health, the field, it is delivered by women, but led by men. 70% of the health and social workforce are women, but less than 25% of those senior leadership roles go to women. Specifically, what we're seeing in COVID-19 is that during pandemics and health emergencies, women's representation and leadership dwindles even faster. So I'll be covering a little bit of that later today. But just to really answer your question, Egle, why is it that women continue to not have opportunities, or why is it that they continue to not be in senior leadership roles? And what that really comes down to is the fact that if we look at the environment and we look at the environment around health systems and society, they're currently not gender transformative. We're not really addressing the structural barriers. Too often what we're saying is telling women to fix themselves to fit into systems made by men for men. And what I mean by that is, for example, take a look at any health system. We have to acknowledge that if majority of the health system is composed and comprised of women in the health workforce, then the way that we design our health systems, from the working hours, the flexibility, especially during a pandemic, to the fact of physical protective equipment being designed for female bodies versus male bodies as default. I mean, these are ways that, structurally we could reevaluate our health system. And what I'd like to say is that more importantly, the health sector is one where we aren't valuing women the same way that we should be, really acknowledging that if we don't invest in women particularly, we're going to have weak health systems. And so women are currently underpaid, undervalued, and in some cases even completely unpaid. And some of the numbers I'd like to pass on to all of you is that if you take a look at the global health workforce and social workforce, half of what women do in this sector remains unpaid, which amounts to about 1.5 trillion US dollars annually. And we know those numbers increase a lot more. So if we're not willing to value women, how are they going to be in leading roles? So I think we have to really talk about how do we have gender transformative policy action. And what that means is looking at root drivers, creating both programs and policies to address these root drivers of inequity, to create enabling environments for all genders. And this really is also about making sure that we see gender equality as everyone's business and that everyone benefits from it. Thank you, Egle.
Thank you so much, Rupa, for your comprehensive answer. I would like to hand over the floor now to Dr. Nicole.
Hello, everyone. Welcome to our participants online. It's such a pleasure to be with you all. And I agree with Rupa. It's always fantastic to see how engaging and, the youth is bringing really the solutions for so many of the problems that we're seeing today. So and thank you, Rupa, for bringing this number of $1.5 trillion of, things that we should be valuing and we are forgetting. So this question is an important one because I think it's highlight the lack of representation of women in decision making, but it's not a reality only of the health sector, right? We are really talking about so many fields. We have politics, we have public administration, we have NGOs, we have environment, could be in the media, and then even in sports. If you go to the the World Cup football, you see that the women are also complaining about their, their salary there and the difference. So in politics, for example, here in the EU with the 28 member states, it has increased from 21 to 30% the representation of women in parliament. So we have improvement in these areas, right? But yet 89% of country leaders really remain men, and less than 1 in 5 of this EU's major political parties are led by women. So I think it's also, you have to start before. Women are not even entering politics, and has to do with this, I think, with this root causes for not being able to have more influence. So the private sector is the same thing. We have almost in Europe, almost 3/4 of those sitting on corporate boards are men. So things have, they really have improved, but that's now with COVID is a time that we cannot rest. We need to take this agenda even further and with more strength. So but more important to me, I think that explaining why women are not represented, I find also very important to understand why it is even matters to have women in leadership positions, right? That's a very important, so why we are here even. So I think in my case, I know why I'm here. I just want to take a few seconds to explain my background because I'm coming from the interdisciplinary field. I'm coming from international relations. I'm not a medical doctor, and I'm someone who has worked for gender advocacy for many decades. But my expertise is in international policy and sustainability. So I really created this institution of Women Leaders for Planetary Health, because if you're a smart human being, you really quickly realize that women empowerment is not about women, it's about a better world for all of us here. So if we make the lives of half of the population harder, as Rupa was describing, of course we're all gonna struggle. So I think COVID-19 is also, besides all the disruptive nature that we're seeing, I think it's also a positive moment that we could really change and reset our mindsets. That's the most important thing. It's because a lot of the problems that we're going to be outlining here has a lot to do with the cultural norms. And I think for that, you need to change the perception and the cultural aspects of this. So from this perspective, I think COVID-19 could be perceived a little bit as positive news if we shape it and that. Thank you.
And thank you so much. And it's really great to emphasize that definitely Women in Parliament is about improving everyone's life and health. I would like to hand over now to Dr. Colleen.
Thank you, Egle, and hello, everyone. Also, an absolute pleasure to be here, and also with a lot of familiar faces and friends. I'm going to keep my answer short. Certainly, I completely agree with Dr. Dutt and Dr. De Paula on what they have mentioned. Maybe I'll mention two specific points to add. So, in healthcare, particularly, women in the past decades and more have had very traditional roles and occupations that were really women jobs. This has changed tremendously, and we are seeing in many countries around the world, and really not so much the high income countries, but really everywhere, that the proportion of women entering really any health workforce or occupation is increasing, even reaching more than the majority of new students, new graduates, etc., particularly for medical doctors and others. This has not translated into the right proportions in leadership by any stretch of the imagination. I would also say that youth is a confounding factor and an additional factor for challenges, both for advancement, promotion, and leadership. Maybe I'll take a very small example in academia, but this is really very true for NGOs and really any aspect of global health and health in general. Women are not promoted at the same rate as men. They're promoted much slower, and that's for various reasons, but not only because of achievements, but also because of certain perceptions on gender norms and gender roles, be it in the home, family care, etc. So what it boils down to is that we're not really evaluating women on their academic output. We're saying that, women are busy at home, therefore they're not productive enough, therefore we're not promoting them at the same rate. This is just a very small example that I would want to highlight and hopefully leave you with. Thank you.
Thank you so much, and also for bringing the academia into the view. I would like to hand over now to Yeva.
Thank you so much, and hello everyone as well. So I cannot help but, of course, agree with the rest of the speakers. So I think the health workforce is simply a reflection of what we already see in society. Even in modern day, we see that women are primarily seen as emphatic caregivers, right, rather than leaders or people who make decisions on high levels. And what this leads to is both internal and external misogyny, and women not being able to take up those leadership positions. And what I would like to mention is the fact that this is very evident in medical school as well, because there are very small interactions that we see on a daily basis where women are not treated as seriously as their male counterparts, or certain medical subfields are encouraged to be associated with gender. And even though this is very small, this adds up, and this adds up in healthcare systems as well, and in the years of women working later on. And let us not forget about the hierarchy that exists in medical settings, and that women are, in fact, at a higher risk of experiencing workplace harassment, which, of course, only adds to the aforementioned disparities. So in the end, this is definitely just a vicious circle that is oftentimes perpetrated and encouraged not only in those daily interactions that I mentioned, but by people in power as well. Thank you.
Thank you so much, Ms. Yava, and also for bringing the perspectives from the medical school part. And finally, I would like to hand over to Mr. Martin.
Yes, thank you. And thank you to the organizers of the World Health Summit for inviting me as a representative of WLH on this panel. And thank you to you, Egle, for hosting this discussion. Before diving into this topic, please allow me to quickly introduce the organization, Young Leaders for Health, that I'm representing today on this panel. Young Leaders for Health is a non-profit organization consisting of young professionals and students from around the globe. we're dedicated to fostering the next generation of leaders in global and public health, and YLA's principles are based on 4 pillars: education, innovation, diplomacy, and advocacy. We believe that only when bringing people from all backgrounds, genders, and generations together, health can be discussed in a meaningful manner. But this is why I hope that even though it's the lunch break right now, mostly everyone from the diverse backgrounds of the World Health Summit has tuned into this discussion. With that, I would like to address your question, Egle, why women are underrepresented in decision-making entities in global health. And would like to thank the other speakers for their input, because there's not much to add for me, but what I want to do is to maybe summarize what you said in 2 words, those being systemic sexism. Because in my opinion, this is what it boils down to, where we're seeing fewer women in leadership in all sectors, not only health. Women are being discriminated against at every step towards leadership positions, being it unpaid maternity leave, structural discrimination through male hire-ups, and sexual harassment. These challenges are not adequately addressed by governments, meaning there's a structural problem, which, as we heard earlier, we only can say health is a political choice, because only when women are in a position of power, women can actually make changes that benefit the health of women, because it is in many ways so different from male health that we can see at every point. So only by having women in position of power, we can actually make healthcare equal and just for everyone. At Young Leaders for Health, the majority of our team are women, and we specifically empower female leadership, because like I said, only through women in leading positions, health of all people can be improved.
Thank you so much for all the speakers for comprehensive answers. I think we already have a very broad perspective. And just to lead on to the next question, even though we discussed that women are majorly not represented in decision-making entities through different sectors, yet it seems that countries led by women seem to have a better response to the pandemic. Why is that? And I would like to start with addressing this question to Dr. Rupa.
Great, thanks, Egle. And I just want to emphasize a bit around the fact that, what we really should be talking about is like, how do we have gender transformative leadership, and how do we apply feministic leadership principles across the board? They're proven to lead to more equitable societies, and particularly what we are seeing in this pandemic is that governments that are headed by women are doing about 6 to 7 times better in the COVID-19 response. Of course, this is a snapshot analysis that was done during summer, but what we are seeing when you take a look at the communication style of head of government, the women are using much more collaborative language. They're using less divisive language, and they also are really, drafting their messaging to their people based on really social protections, and not just really looking at it from an individual lens, but really a societal, holistic lens. And all of those things really lead to a better, COVID response, because one, it leads to greater trust. So the less divisive we are, we'll have more public trust, and that leads to better public health impact, really in our outreach campaigns. And the second part of it is when we have social protections, it reduces the inequalities, and we know they're magnified and heightened in the pandemic. And so this also leads to not only looking at the COVID-19 purely from a who's infected and who's died perspective, but really the broader inequities that we're seeing. So when we take a look at like why women are doing better, I think it really has to do with the fact that one, there is a gendered aspect to the leadership style, and that leadership style tends to be more feministic and more collaborative. But we are very clear that men and women and all genders can really practice that leadership style. So it's not inherent that all women will be gender transformative leaders. It has to be truly a mindset. But societies that have made it a priority and been enabling enough for women to rise to the most influential leadership roles also have other traits, and we're seeing that play out in the pandemic as positive things. And so again, what I would say is that we need to ensure that when we're looking at leadership styles, we're really looking at the characteristics and how all genders can embrace those characteristics, and how those characteristics should be really welcomed in the pandemic response. response, and let's, put an end to macho style, cowboy style addressing health emergencies, but think about, what is a holistic, comprehensive approach look like? And that really does mean being collaborative and less divisive and really putting social protections forward first.
Thank you so much for your inspiring words and also for putting the gender and transformative leadership on the table in our discussion. And now I would like to hand over to Dr. Nicole.
Yeah, I think that's a super important question because, again, we're talking about the importance of having women in politics. And we mentioned that before, that we're still lacking considerably. So this equal participation of women and men in politics are an important condition for effective democracy and good governance. So that's a very good outcome they would have of having more women. And COVID-19, the interesting is that we had a very stress test for this feminine leadership style. That's something we are still, as we have preliminary numbers, as Rupa mentioned, is 76 times better than countries led by men. But of course, we need more research on that. And it would be interesting to see, and that's something we have been discussing with our team at the Women Leaders for Planetary Health, is it women doing better, or the societies who elect women doing better? That's also a good question to, I think, reflect. I think if you have the space for women to take, these power positions, I think they will have other dimensions there playing around. So we know that in the US, for example, the failures had a lot to do with the leadership style and this systemic, we are talking about racism a lot and other systemic conditions that also, I think, it was mentioned, Martin mentioned before. It was a lot in the media. It was interesting to see how, the New Zealand became a very important case studies to show that it was exactly about the communication style. What is leadership in this context? And the three words that appeared there is the related to theory of communication even. It's like this direction giving, meaning making, and empathy. This was all over around in the media. It was a very interesting way to summarize what it means. And of course, most of leaders using more this direction giving part of the leadership. So the successful parts was really related to the communications. And this, I think I can talk about, I'm from Brazil living in Germany at the moment. And when you have Chancellor Merkel right at the beginning, being courageous and going there, said, this is going to be bad. But let's prepare for it, not trying to hide the problem, taking ownership and communicating, explaining to people why they need to care. And I think what is really important in this perhaps feminine style of leadership is this involves the capacity to persuade the collectively to take responsibility for the whole. And I think that was something that happened in New Zealand that people were highlighting as good, as opposed in the UK, for example, when you have media inquire, there was not space for media, so they would do communications but no time for questions. So I think those were one of the details that really gave space and perhaps saved lives in the end. Thank you.
Thank you so much. And also building on the previous question, although we did tackle it in some way already, but just to emphasize it a bit more, what can we learn from the involvement of women in the COVID response? And I would like to direct this question to Dr. Colleen.
Yeah, thank you very much, Egle. And I think we've heard quite a bit already, but maybe just to, as you mentioned, build on a few points. So learning from the COVID response, I think we have quite a few things to learn from. Number one, women's involvement as 70% of the healthcare workforce. You can imagine that was a tremendous contribution to the COVID response. Yet, I think this was already highlighted by Rupa earlier on. There were so many challenges, including personal protective equipment or PPE, that really did not fit women, and that you can imagine if 70% of the care workers do not have proper personal protective equipment. It's talking about size, not availability, because I think availability affected literally every one of us around the world. So that is one challenge. Second, involvement on the research level, at the epidemiology level, at the public health level. We've seen tremendous names and thought leaders, and I certainly would like to give a shout out to the COVID 50-50 initiative by Women in Global Health that also highlighted 100 women in the COVID response and 100 thought leaders as well. Many of them you probably see either on social media or in the media, even though not in an equal fashion in any way, shape, or form. So we have thought leaders, yet they do not get the time or the platform to be able to help, and not only help, but also lead on this. What can we learn? I think very obvious, we can learn quite a few things. At the same time, we have the child, elderly care, home care that fell on the shoulders of these women for the most part, those who are the frontline healthcare workers, those are the epidemiologists, public health specialists, etc., all around the world. Also, people doing home care, they are lacking personal protective equipment until today. And that if the realities have changed for some of us on the front line, which I promise you, even in high income countries, it has not been resolved. Can you imagine what the frontline home care workers are facing during COVID-19? And I do want to mention, I know this is a global health discussion, but let us not forget the essential workers who are outside of the health and social care sector, who are for the largest majority in most of the world, are women. And during the most severe lockdown, those people were still needing to go to work, to leave their families, to put themselves and their loved ones at risk for usually very little to no remuneration, and then less recognition, certainly, than the frontline healthcare providers. So I think that there were so many gaps that for women, women's contributions, response, participation, and those mistakes I highlighted. I certainly hope that this is an opportunity for us to learn. Going back to the discussion on building back better, how do we ensure that women are not only present, allowed to lead, have the proper equipment, and also have the proper opportunities and help that they need at home and outside of the home to be able to respond better to future challenges. So I think I'll stop here.
Thank you so much, Dr. Colleen, for your insights. And finally, for this question, I would like to hand over to Martin.
Yes, thank you. And thank you, Dr. Colleen, for highlighting that the majority of the burden of the COVID-19 response is being carried out by women. However, in the meantime, women also carry a large burden of disease directly from COVID-19. This is due to this pandemic exacerbating the already existing inequalities like crises before have done. This means that there's less access to sexual and reproductive health for women, because even though against WHO guidelines, many of these centers have been closed down, leading to an estimate of 7 million unintended pregnancies. Furthermore, by closing schools and other education institutions, those schools that served as safe environments for vulnerable girls are now closed. Additionally, what we've already heard is the gender-based violence that had a surge during the COVID-19 pandemic. And just in the first week of the shutdown in France, there was this 30% increase in gender-based violence being reported. This healthcare crisis of especially female health is not adequately addressed. And again, because health is a political choice. And what we've seen that the national-led COVID-19 response committees are not gender equitable, while we're still seeing that women carry the largest burden of disease and the largest burden of the healthcare. And we cannot allow women to disproportionately suffer from the effects of the pandemic while still relying on those women to then carry out the largest work of the COVID-19 response. And what we need to do, what governments need to do, is install women and place women in places of power where we can assure that women's rights and health will stay a priority during the COVID-19 pandemic and moving further.
Thank you so much. And before we move on, I would like to remind to our audience that also the possibility to ask questions is still remaining, and we are waiting for the questions. If you would like to have them, we will address them at the end of the panel. Moving on, The next question is, what could be said about the gender disparities resulting from the way the COVID response has been conducted, or perhaps it would be more correct to say exacerbated from the way that the COVID response has been conducted? And with this question, I would like to start with Dr. Rupa.
Great, Eglin. I just want to emphasize that we've covered a lot of that question already. So I'm going to, again, emphasize a few things that really we need to walk away with. So one, COVID-19 has exposed deep inequalities within and between countries. We know that we've talked a lot about gender inequality in the health and social workforce, but we must also talk about the deeper inequalities that are based on race. Sometimes it is the status. So if you're a migrant worker, or it can be based on caste system. In India, we know that it is usually the lower caste that are the frontline workers. So I think it's also important to look at things from an intersectionality lens, and COVID-19 has reminded us to really do that. And these, long-standing inequalities really weaken our health systems. The second thing is really around, the role of universal health coverage. When we think about gender, we must see gender as part of health equity. And I've heard many of our, co-panelists really talk about this. We know universal coverage is essential to health security for everyone. And now, COVID-19 has reminded us that we need to guarantee that everyone has access to affordable healthcare, and particularly free healthcare, especially when it comes to a pandemic. We've heard that women are experts in health systems, and then when we exclude them from decision making, it weakens our health system and pandemic response. So some really great examples is that when you have women in leading roles, they are going to prioritize the social protection needs. They are going to invest more in education. They're going to invest more in the mental and psychosocial aspects. And these are, again, things that we are hearing more and more that health workers need much more of. So yes, we want to applaud the great work that health workers are doing, but we need to turn it into real action, real investment. And that's an example that COVID-19 is, again, spotlighting, that we must also go beyond investing in a classic way, but look at gender transformative environments that really create safe and decent work conditions for health workers. We've heard a lot about diverse perspectives in leadership matters. And, this is critical into not only making, it's not only the right thing to do, but it leads to a smarter response. Some of the dividends that we've seen when you have diverse teams, I'm not only talking about it from a gender perspective, but also broader diversity, multidisciplinary, having health workers in task teams and working groups. We know that there's going to be not only, a gender dividend, a health dividend, a development dividend, but we've also seen that there'll be more innovative solutions, more sustainable solutions, and actually ethical decision-making is more likely to occur when you have, gender diversity and broader diversity in these task teams. And just to give you a number of how stark the disparities are, going back to your question of what COVID-19 shows us, is that when we mapped out women in global health, did a review of 115 task teams and advisory groups from 87 different countries, what we found is that 85% of those task teams are majority men, and less than 5% had gender parity. It was very difficult to get this data. It's not transparent either. So there's a lot to say about what COVID-19 is showing as we look into the gender aspect of it. And then, some of the other things I'd like to really highlight is we can't win this fight against pandemics and normal health challenges if we're only using half of the global talent pool. And we've heard again and again in today's panel, women have experience, expertise, and frontline perspective. And we also know that women, especially from global south, lower middle income countries, are left out of decision making in global health. And when we miss out on those perspectives at the global level, that truly does have a ripple effect and weakens us. Women are shock absorbers. They're carrying the unpaid work. We've heard already those numbers of how women on average have 2 to 3 hours of unpaid household care work they do in a non-pandemic time. But with a pandemic time, many of the women are actually formally leaving the workforce, providing both childcare, elderly care, and at times even primary health care. So as Colleen had alluded to, the home care workers include almost everybody at this point in time, and they do not have access to safe working conditions, nor are they being compensated. And this really also weakens us. And just, finally in closing, gender equality is not only a women's issue, and we're finally seeing much more male engagement. It is great that we have Martin here on the panel, but we're having many more, many more organizations and many more men acknowledge that, gender applies to them as well. As we've seen COVID-19, the early data showed us that men were getting more infection and dying at higher rates. We know this is still incomplete data, but there is something to looking at how men intersect with the health system and how harmful masculinities and how overall the biology dimensions all play in, and COVID-19 has spotlighted that. So this is, gender is no longer seen or should be seen as a woman's issue, but should be seen as, an aspect of understanding, everybody and everybody's business. And finally, in this, callback to build back better, what we're seeing is that COVID-19 is the first time in a very long time that, health is really at the head of every government's mind. And it's an opportunity for us to really make sure that as we're thinking about health and how health is linked to our economic well-being, the two are truly seen as interconnected, and that we build back better in a way where health is not seen as just a cost, but it's seen as an investment. And in this build back better, we really have an opportunity to create much more equitable and particularly gender equitable health systems. And particularly, that's new in the COVID-19 response.
Thank you so much for the answer. And now I would like to hand over to Ms. Yeva for the perspective from the medical student side.
Thank you so much. So I think I will just reflect that it is very important to stress that, well, we have to be honest with ourselves, right? The pandemic is not something that created gender inequity. This just exacerbated a bouquet of issues that existed beforehand. And there's, of course, an overwhelming amount of data that is already present on the possible factors that possible results that women will face because of the pandemic. And we see that the wage gap is about to increase. We see an increase in violence. We see women taking up more unpaid care than ever. And we see that if we look at gender as more of a spectrum, I think the world has taken the pandemic as sort of a nice way to forget about gender equity and to try or even pass laws that are very regressive instead of taking even more progress in gender equity. And I think right now we need to be more ambitious than ever, and we need to not take no for an answer, because gender equity in times of the pandemic, it's not a last priority, and it's not something we remember as an afterthought. It's something that is fundamental in leading a truly effective response. Thank you.
Thank you so much, Yeva. And finally, I would like to hand over to Dr. Nicole.
Thank you. I think I totally agree with this nature of the multidimensional nature of this crisis. That's a key point, I think, in our conversation here. And I would like to bring the perspective that where I have more experience even, is that the important to connect this planetary emergency that we're having and the rising inequalities, but the solution will be this planetary health. And that's the concept that I really, and it's more than a scientific field. I think it's a social movement, and the first part of our panel really highlighted the importance of dealing with this question. So women, they are already disproportionately suffering from this current crisis, as we are showing here very clearly, but they're also suffering for many other planetary emergencies that also already existed. So the climate, for me, the most important is that this climate and biodiversity crisis that we are seeing cannot be perceived in isolation either. It's not that we see a lot in the youth movement sometimes at the beginning said, oh, now we have a health crisis. What do we do with our climate movement? And it's, I think, an absolutely mistake to perceive these two crises in isolation. They need to be combined. As we know, we need all the disciplines together, and it's a transdisciplinary approach that we need here, meaning that it's not only a research, it's not a top-down, but there is a lot of knowledge coming from communities, they know best how to deal with this. So it needs to be very context oriented. So just to give an example how this planetary emergency is also affecting women already, there was also research showing that women in Bangladesh, for example, they were 14 times more likely to die from natural disasters. So if we consider that climate change will, getting worse and worse, of course, women will also be affected by this type of tragedies as well. Water, when you see the water scarce regions, it's essential. Now COVID, they have two calls, right? Stay home and wash your hands. A lot of people, especially in the global south, they would not have these homes to stay, and they would not have clean water to wash their hands. We tend to forget these things, especially when you give recommendations, so ride a bike, for example, and just take a train. That's not a reality, in most parts of the world. So that would be a very good recommendation for Europe. But would it work, in Asia? Would it work in Africa, in Latin America? That's something we tend to forget. So if you want to propose real solutions, we have to incorporate what will be the solutions in these regions as well. So what I really like to say that what seems relevant to me, so it's go beyond this narrative of victim of women, right? I think women, they're really part of the solution. There is a way that, again, it's definitely not a question for only women. We have men completely engaged because that's what we're going to benefit the entire society. But there are some interesting numbers. I'm going to say that only 11% of ceasefire agreements include gender provisions, for example. But then there's also research showing that women, when they are included in negotiations about security, in peace agreements, are more likely to be durable. So we can even say that this shows that having women in decision-making tables, not only good for health, but I think it's good for world peace. And that's a very important and big topic here. I think that's we tend to forget these connections to politics. And I find very important. We're now digitally, for the first time, the World Health, we're having the summit digitally. But when you take these numbers of who is shaping, communication and technological tools, we see that 85% are men. So we need also to get women engaging in this type of new reality that we're going to have digitally, especially. This is valid for, also let's say cryptocurrencies or new ways that we're going to have that are evolving so fast in times of COVID. So I would really think that it's very important for us to understand this, the health crisis we're seeing is really, the solution would be a planetary health dimension. There are clear connections. If we protect our nature, we're going to improve, mental health. We're going to have better, it's a remedy against future pandemics. We're going to protect against climate change. So all this needs to be tackled together. Thank you.
Thank you so much. So for now, we have discussed such a huge bouquet of different issues, but also proposed already some solutions that are already carried out or perhaps that could be implemented in the future response. With that, I would like to take back the attention to the youth part. And the next question would be if it would be possible to highlight any good practices that have been implemented regarding gender and COVID response. And I would like to address this question to Dr. Colleen.
Thank you, Egle. So very briefly, because I know we're running short on time, but I also am the chair of the Global Health Workforce Network Youth Hub that brings together healthcare students and early career professionals. And just I want to mention two examples of good practices that we heard from our organizations. And I would say that for the most part, youth organizations have been very proactive in terms of gender equity initiatives, even before COVID. So the first one, just going back to the issue of decent work, I know that many of you have heard that healthcare workers and frontline healthcare workers have been targeted with violence and attacks on their way home to work, particularly those doing direct patient care with COVID. This was due to misinformation, misunderstanding that they're bringing COVID back to their neighborhoods. Some have been kicked out of their homes, etc. So we have had local youth organizations organize themselves to accompany women going back home from their workplace, usually hospitals, to make sure that they get home safely. And as you can imagine, this is something that that is very important and also very meaningful as far as contribution. The second example is volunteer student organizations in the healthcare field who may not have been able to directly be at the front lines yet because they're still at the student level. They have organized themselves to assist women with childcare during working hours so that they are able to be at the front lines caring for COVID-19 patients and responding to the pandemic. Just two very direct examples, and I'm going to stop here. Thank you.
Thank you so much for sharing these examples. And I would like to hand over this question to Ms. Yava.
Thank you so much. So what we saw, especially in the beginning of the pandemic and currently, is youth mobilizing and reacting very, very promptly to the complete change of our reality. And what we saw is youth becoming a driving force behind disseminating evidence-based information across multiple platforms and levels. And especially in regards to SRHR and IFMSA as a youth-led organization, we saw a huge increase in capacity building spaces that had SRHR and the pandemic highlighted, and the possible issues and possible solutions that youth could take lead on. We also saw collaborations. For instance, IFMSA collaborated with UNFPA in creating a series of webinars on how COVID-19 affects youth, which had an SRHR perspective as well. Internationally, we had an SRHR resources library created that could be used by activists all over the world globally, on local, national, international levels. And what stood out a lot was the fact that on national levels, we saw a lot of mobilization of youth collecting resources on domestic violence and acting as people who helped women who were facing an exacerbation of this issue, and they disseminated information and definitely helped on a very grassroots level. And what this shows is that while the world is concentrating on the immediate response, it's concentrating on creating the vaccine, we see that youth has become one of the main stakeholders that hasn't forgotten the issues that were pre-existing, and we are still treating them as fundamental, and we truly do not want to leave anyone behind. Thank you.
Thank you so much, Yeva. And finally, handing over to Mr. Martin.
Yes, thank you very much. As we've discussed earlier, I think the main thing that we as the youth need to do is fighting the institutional inequalities we've talked about beforehand. But I think something else that we briefly touched before are the indirect effects by COVID, for example, due to the lockdown, and especially when talking about mental health issues. And just to give a quick example from the experience within our organization, where I think it is very important that even during professional talks and in all organizations, I think it's very important to have, especially during these times, also the personal part where it is possible to discuss personal issues, to discuss issues of mental health in these situations of lockdown in order to alleviate the problems that could be caused by the lockdown and that deteriorate the mental health.
Thank you so much for your answer. And even though we extended into a few minutes over time, I will still allow to have one question from the audience. So we received a question that Dr. Rupa has mentioned that 70% of the panels actually have been consisting of men related to COVID. And if the speakers perhaps have some success stories that they could share about the panels they saw that actually had gender parity. So Rupa, over to you.
Great. I'll be really to the point. A prime example is the independent panel that's been put together to evaluate the COVID-19 response, which is chaired by Helen Clark and Ellen Sirleaf-Johnson. And that actually panel has a gender parity, and not only gender, but also geographical diversity. And the African Youth Envoy, Aya Chabi, also sits on it. So really delighted to see youth representatives. So that's one example of having both a gender balanced panel, but also intergenerational panel. So again, that's shown that when you have that type of panel discussion and group comprise, we're hoping, again, we're waiting to see what their actual report and recommendations would look like, but we really are hoping that it'll be a much more intersectional and gender responsive type of recommendations that they're putting forward.
Thank you so much. Dr. Colleen, what is your experience?
So, I think that there is a little bit of a difference between having kind of short-term panels that at conferences, etc., which, by the way, are completely essential to have women's voices, youth voices, etc. But also, I think a prime example is what Rupa mentioned. Those are the kind of panels that we would like to have women, young people, and people from all over the world represented on, because this is where most of the work, or a lot of the work, actually happens. Again, shout out to Women in Global Health, who have called over the years on panels to be more gender equal. And hopefully we would have now the IFMSA and the youth organizations also supporting youth being represented equally, both on the speaking panels, but also on working panels.
Thank you so much, especially for the point on the working panels as well. And now handing over to Dr. Nicole, what are your thoughts on the question? If you would have maybe some perspectives also from the climate change.
Yeah, I think it was good to have these examples. I mean, I don't have the good examples, unfortunately, for the climate change, and it's a good to actually highlight. And there was a recent petition. This weekend, I was discussing with a very powerful group of women about the next climate change, the COP26 in the UK presidency. And apparently all senior politicians, civil servants and negotiators to represent Britain are all men. So there's now a movement to see that, again, we're going to enter this narrative that we're going to have apparently all men shaping the next negotiations on climate change. So that's something that perhaps we can get mobilized and call for more women also in this case, for example. Thank you.
And thank you so much. Over to Mr. Martin.
Yes, I would like to second the statement of the other panelists, and also thank you for mentioning the generational gap, especially in the panels. For example, we're looking at the panel that's at the World Health Summit, parallel to this one, which is titled Climate Change and Health. I think it's a bit sad that we don't see any youth representation on that panel. I think when we all know that for our generation, this is a really important issue, and going forward, this is something that in the Young Israel perspective is very important to see representation on these kinds of panels as well.
Thank you. And finally, the same question to Yeva, maybe with a twist also. If you would maybe have some examples of what else, other than panels, also could be done in order to ensure better gender parity in youth organizations.
Thank you. So a good example coming from IFMSA specifically is the fact that internally and externally we have guidelines that do ensure representation on both gender and regional level. And we definitely use that and we implement that so it exists not only on a paper level, but we actually do it in action. And I believe this is something to learn from and to implement in other areas as well. Thank you.
And thank you so much. And with this, we are moving towards the very end of our side event. And now I will give the floor for the speakers for their final closing statements. So now we will start with Yeva.
So I will try to keep it short and simple. I think it is high time to treat youth not as someone to involve, not only as someone who will act in the front lines of the pandemic or any other global health issues, but as experts in their fields, and especially in regards to ensuring gender equity and actually finally accelerating progress. Because this was mentioned before, our vision and energy, they're intrinsic in every response possible. And not only in the immediate response, but also preventing long-term consequences and actually ensuring the best possible future. Thank you.
Thank you so much. Over to you, Mr. Martin.
Yes, first of all, thank you for the fruitful discussion. And as my closing statement, I would first like to state that in my opinion, we shouldn't classify this current pandemic as, or this current crisis as a pandemic, but rather as a syndemic, meaning it is a synergism between the pre-existing inequalities and then the coronavirus that we're all facing. So in order to really tackle all the health problems that we are facing currently, we can't only focus on the virus, but we also have to reduce the inequalities. And I think when we do that, we can first slow down the suffering that we're seeing right now, and we can also afterwards have a world that is healthier and better prepared to take a future health crisis.
Thank you so much. Handing over the floor to Dr. Colleen.
Thank you, Egle, for having me and for the great panel. A short message, I think, just using the same terminology as the colleague before, it is high time that we recognize women, young women, women from low and middle income countries, both as thought leaders, also as frontline health workers, reward them, remunerate them, and ensure that they get to the leadership positions that that they deserve and that they are fit for. A pretty strong message from my end is for the frontline health workers. They deserve decent work. Women, young people, really everyone, but more so focusing on women and young people who tend to be, based on all the evidence gathered prior by various hubs at WHO, they are the ones that are facing the biggest challenges. So decent work for women, young people, and everyone at the front lines. Thank you.
Thank you so much, Dr. Colleen. Handing over to Dr. Nicole.
Thank you. Thank you, everyone, for this fantastic conversation. I think in 2020, this COVID situation really is giving us a second chance. We have all the information to do the right thing. We can do and we should do the right thing. And the right thing to me is really to promote a planetary health in a gender just world. So that's, to me, is my essential, every day I will wake up to do, because I do see this crisis so connected. And it is interesting to know that our conversation is also happening during this disruptive times of COVID, but it's also when the United Nations was trying to achieve this global and having this multilateral cooperation, all this, which is so necessary, is celebrating 75 years of its existence. So it's just a bit sad that we are in such a disruptive moment. There is not a lot to celebrate in this from this perspective. But I would like to highlight that these issues of borders, populist decisions, they will really not protect us from the next pandemic. So we need more women leaders that can really promote planetary health, because it makes economic sense as well. That's something that we tend to forget, and it's gonna then benefit everyone. So I think a final message here is that a just society and a resilient planet are really the best vaccines for the future. And I hope we can continue working on this together. Thank you so much for the invitation to be with you all today.
Thank you so much. And finally, in order to end our side event, Dr. Rupa.
So COVID-19 really is a global wake-up call for building back better. And we have an opportunity to really do something that could change health systems, but more importantly, societies to be more equitable. So my call to action to all of you tuning in is please join our COVID 50-50 5 Ask campaign for a gender responsive global health security approach. And what we're really asking for is a new social contract where women who deliver our health and social care deserve a new social contract with decent working conditions and equal role in decision making. If we look after all of our health workers, they will keep us safe. And that's really my closing call to action is please join us and tune into Women in Global Health. And we hope that you will contribute to the movement as you're all invited. Thank you.
Thank you so much. And I urge everybody to accept this invitation and to join the movement. By ending the event, I would like to thank on behalf of IFMSA to all the speakers that have attended and prepared for this event. It really has been fascinating, and I personally feel extremely inspired to go and take forward that action after this panel. We are extremely proud also to have our alumni leading the global health agenda. And thank you so much for all the leaders, all the youth speakers that have participated. And for all of our audience, we also hope that this panel also has in a way empowered you to further continue your efforts in both gender equity and also meaningful youth engagement. Thank you so much for everyone who participated, and I hope that you have a great day. Goodbye.
Great. Thanks. Bye, Egle.
Bye, everyone.